Hi, I'm Dr. Ryan Greene, co-founder and medical director of Monarch Athletic Club, and I am grateful to be in the presence of Dr. Bryan Hixson of Brain Performance Centers of Southern California to talk about the collaboration between our two concepts, living in what we're calling Monarch Mind. And Monarch Mind has been something I've been ruminating over for a very long time. The origins, and I don't think you knew this, but when I moved out here to California, I was invited to Red Bull's Glimpses conference.
You mentioned that.
I don't know how.
Yeah.
So I was like a nobody, still kind of a nobody. But somehow Andy Walsh found out about what we're doing, invited me to Glimpses, and it started the wheels turning on like high performance. And then I read The Rise of Superman and learning about flow state and like the entire scientific effort to like figure out how to work with this to help with this. And where I come from in the traditional medical environment, like if it's a mental health issue, it's usually pretty severe, dealt with by psychiatry, typically medication or some other things, cognitive behavioral therapy. But when Monarch was created, like it makes such perfect sense to mesh the two together, because ultimately what we're trying to do is help people understand like simple things done consistently, repeated over time, utilizing technology, utilizing, precision components that we have available, looking at internal, external, what's your body telling us, how do you move, should allow you to live a long and healthy life. And when we talk about longevity, if you look at blue zones and other things, like I'm kind of championing this idea that like I think we've solved longevity in the sense that eat well, sleep well, have community, pay attention to what your body's telling you and do it repeatedly, you'll probably live a long and healthy life. Like we've already shown that.
Yeah.
The area that's novel is what you do, because the brain, the mind, everything in that space, it's like we exist, and it kind of blows my mind, pun intended, to think about it, because it's like the brain is a part of all of this. It requires neck down to function well so that it can do what it needs to do, neurotransmitters, minimizing inflammation, it needs fuel, it needs like all that kind of stuff. And yet it's also like so impactful in terms of how we connect with other people, anxiety, depression, insomnia, sleep quality, the impact of sleep. So, traditionally what I saw was like, what you have in some of your literature, it's like people go in, they have to be in a room for 24, 48 or more hours. They have electrodes glued to their head. They can't move. They're wrapped in gauze. And it's just like, the only people that are really going to do that have serious seizure disorders or some sort of like pathology. So the interesting part about what we're doing here is similar to all the information that we're collecting neck down. Like the one thing we haven't been able to do is like, how is this playing a part in this? And then also, how is this impacting this?
Exactly.
And if we can have that full circle understanding, that integration, we really can pretty much answer any question that we need to. What we do with that is where this, the technology component comes from. And so like, I'm super excited about starting here, because at the bare minimum now, like you've said to our teams, we are assessing the brain, like we are assessing the body in terms of how is it performing, like just bare bones, what's working, what's not. You've been more on the cognitive side of things. What excites you about this integration, and where do you think, the world of, and it's hard to call like mental health, because I think mental health is pretty broad, but it's like, how would you describe what Brain Performance Center is doing and like it's what it's providing in the Monarch ecosystem?
Right. Well, I think it comes down to very much like the physical body. One of the great sayings I've always loved is if you can't measure it, you can't improve it. Right. And that's been the problem with the brain, with the mind. It's been this elusive thing that you can't measure. So if you can't measure, you don't know how are you supposed to improve it? How do you know if there's problems occurring or not? And, with brain mapping now, we can objectively look at the health of the brain in the same way we look at the health of the body, just like we can do an EKG of the heart and measure all the heart activity. We can do labs on the blood and on your different organisms in your body that can really show us how they're performing.
Yeah.
We can do the same thing now with the brain and understand, is it performing correctly? Is it, and not just up high. A lot of people can perform really high cognitively, but do they get the recovery, right?
Yeah.
And that's why, so much of what you guys are doing and stuff is tracking things like sleep scores, tracking heart rate variability. Are you able to recover? You cannot push your body if it doesn't get the recovery. And it's the same thing with our brain. And we need to be able to look at those things and see, the brain is 2% of the body weight. And yet it takes 20% of the entire blood flow to run just a, normal average brain without stress.
Probably burns around that amount of calories in terms of percentage. It's
Absolutely.
a furnace.
Absolutely. And so, when we look at the brain, what I love about what this kind of partnership is it's looking at the entire brain and body together as a physical component. The thing I don't like about mental health is there's a little bit of a stigma there that says, oh, I must have a problem or anything. You wouldn't go to the gym and someone tell you, hey, your core's not, near as strong as your back. That's giving you problems. There's no stigma attached to that. We're going to work on your core and build your core, and that's great. And we can do the same thing with the brain, which helps your sleep, and then your sleep helps weight loss. It helps your recovery for your muscles, and then your exercise and specific things that you do here help in turn the brain.
Totally.
So it is one cycle.
One of the things we talk about with Monarch is the majority of what we do is movement related. I understand that. When we built this concept, I appreciated that what is going to get people to participate has to be movement. It's something's tangible. It feels good. You feel like you've accomplished something. The truth, though, and we would tell anyone here, is sleep, hydration, the food you put in your body, what's happening metabolically, all those things have a greater impact and importance. Well, why is that? Well, to be honest, if you're not getting sleep, this doesn't work well. If you're feeding yourself garbage, this can't work well. Metabolically, as we talked about previously, all of these hormone signaling mechanisms pretty much start here, and then the signal comes down and the peripheral organ systems produce what the brain is ordering. It's like a menu. This is telling us. And if the languages are disrupted or the pathways are impacted, exercise will only get us so far. And then, what happens? People either stop doing it altogether or they overcompensate, which creates more of negative feedback. So, I think any health concept that is going to continue and perform well in the future has to look at cognitive performance, and even shifting away from the idea of mental health. It's it's health.
Yeah, it's health.
It's health.
It's the foundation. Your brain regulates your sleep cycles. A lot of people think it's just about getting to bed about half an hour earlier,
Sure.
or don't watch their, look at their phone as much, which those are all great things. But they're small things compared to the electrical activity that regulates the sleep cycles, right? That regulates hormones, I always tell people, a lot of times people get concussions and it affects the back of their brain, which is the visual spatial area of the brain. And I always tell them, you want to keep that area doing well as you age, not only for your vision, that's important, but spatial orientation and proprioception, the vestibular system. When that area starts breaking down as you age, what happens is you start losing your balance. And when you start losing your balance as you age, then you fall down, maybe you break a hip or something. And I always tell people, you watch what happens to a healthy person when they're older and they get in a wheelchair and they stop movement for 2 or 3 months, their cognition drops.
I saw when I was in the surgical space, the mortality rate 1 year post a long bone fracture, outrageously high. And the interesting thing about what you said is that change, which is inevitable, there is going to be decline as we get older, but pair that loss of balance, awareness, visual spatial performance with lack of mobility, lack of flexibility, lack of strength. It's like a perfect storm. You're just it's one of the things that we say to people is inflammation, lack of movement, poor sleep, poor diet. It's like rust in a system, and as it slowly erodes. And maybe it was you that said it, but once rust has, eroded away, like you can stop its progression,
Right.
but you're not rebuilding what's already been eroded. So like the earlier you start, the better you'll be long-term, and I have two questions coming off of that, which is one, how did you find yourself in neurofeedback? Because, in the world of neuroscience, you could have gone any pathological direction. So like, how did you find yourself in the neurofeedback world? And we'll start there.
Yeah. My background, again, is in neuroscience. And with that, I was my main interests were pain management. And with a lot of things like migraines, chronic pain, these are things that there was no medical answer for necessarily, right? And we always knew they were in the brain. A lot of people say, or you'll hear a lot of doctors, or orthopedics saying, well, I think that pain is actually in your brain. And I think they know, if they really thought about it, all pain is in the brain.
Totally.
Right. And, without having, the brain doing certain things, you don't even feel pain at all. And so that kind of led me into that area. And then I was working with a doctor at UCLA in a physical medicine practice where they had just introduced this neurofeedback. And it really kind of revolutionized the way I looked at the brain, because this was now, neurofeedback is like physical therapy for the brain. You can objectively analyze it. You can train certain areas of the brain to get stronger, certain areas that are over strong, that aren't coming back to a relaxed state. You can train those down. It'd be like the more you flex an arm or work out an arm, a lot of times the more you have to stretch that arm and stretch that muscle to maintain good, activity in there and range of motion.
Before we get into like some of the people that you've worked with here, like what do you find are the biggest challenges in terms of people being open to at least assessing their performance? Like, one of the beautiful things about Monarch is, and we're grateful for it, is all of our members get a complimentary assessment, because, we've often found, especially with mental health, and I think that's something we talked about before this, is like, we're not diagnosing pathology. You're not going to come out of this, like you may in a full body MRI and find you have tumors or, some sort of pathology. That's not happening. This is just literally, like we've said before, the equivalent of like, how many push-ups can you do? What's your VO2 max? What's your grip strength for the body, but for the brain? Like, what's the analog for that? So, like, what have you found are some of the biggest areas of sensitivity people have to even participating in, and I think that's the other part of our society right now is most people, unless you are acutely ill, we've kind of trained ourselves to be like, I can push through it, or I'll caffeinate my way through it, or Tylenol my way through it. So what are some of the biggest areas of resistance, I would say, for people wanting to participate in this program?
I think that a lot of people, there's a stigma that goes around mental health, right? So when they feel like this falls in the mental health space, there's that stigma. Well, I don't have as bad of a problem as someone else. I don't need that. Where this is more about the performance side, this is more about the optimization side. I think everybody would say they have some level of anxiety. And I always say the acute anxiety is good. That's what drives us to get something done. We want to have that acute going up. That's no different than me flexing a muscle. But then we need to relax the muscle. We need the brain to be trained to come back down, go up and down as we need. So, this is, a lot of people think this is, you're going to find some tumor or something that you just tell them, okay, you only have 30 good days left, or something, which is completely the opposite of this. In fact, anything that we find, we can help that person improve. So there's nothing that anybody should be afraid of. The only thing that people should be afraid of is never looking at their brain until it breaks. That becomes the issue. With AARP, who I've done a lot of work for, running their dementia prevention program, and, we did a study where we saw the optimal brain health, people that, again, work out, take care of themselves and do things, they can keep their brain from 40 years old to 80 with less than a 10% drop in cognition. Less than 10%. The average 40 to 80-year-old drops 70%. So there is a huge amount of optimization that needs to take place. I always think that dementia where it is today would be kind of like if you've never heard of a dentist at all. And we always wonder why everybody in their 70s, their teeth are falling out. Well, if you don't do any prevention, you don't look at anything that's going on, yes, you're going to have that. Whoever goes and looks at their brain just to see how well it's performing before you go to a neurologist once you have a brain break or some major problem?
You know, for someone like myself going to get assessed, my first thought is like, I just want to score the best I possibly can so you'll be proud of me. But also, like, I should probably look in and figure out, like, I'm an entrepreneur, I'm a co-founder, like, my sleep quality definitely could be improved. So I'm grateful that not only our population has embraced this, but also I think, like, as we were talking about before we started, like, a lot of younger people are getting a little bit more interested in this, which is, I think, a pretty interesting change. Because when I'm thinking about, like, my parents' generation, you know, it's almost like too obscure of a thought, and it's almost like they're too entrenched. And obviously you're working with AARP, but, you know, we have to really move this initiative to, like, the younger generations.
Absolutely.
Because, like, you know, even with, you know, psychedelic assisted therapy, like, the generation that lived through the 60s and 70s that use it all is, like, now the people that are very afraid of it. So how do we get this next generation of people thinking about not only physical health, but how health in general includes the physical body and the cognitive space?
You know, one thing, just to jump in based on what you said too, I think probably another thing that probably impedes maybe some people of doing it is the performance aspect, even how you mentioned, like, I want to do the best at it, right? And I always tell what we're doing is similar to a resting heart rate. Now, my resting heart rate and LeBron James' resting heart rate is probably somewhat similar because we're both healthy people. If you put us both on a treadmill stress test, he would blow me away.
Well, okay.
Now, most
Give
likely.
yourself some credit.
Yeah, no, most likely. So, you know, but that's the thing. This isn't necessarily about, like, a cognitive test. We're not scoring someone on their cognitive abilities.
It's not an IQ test.
It's not an IQ test. This is basically like a resting heart rate. Is your resting heart rate coming down good? Is the resting side of your brain coming down to the right electrical activity towards optimizing all the recovery just as much as the performance? I always tell people that, you know, I've mapped probably 6 of the top billionaires in Silicon Valley, and we've done probably thousands, you know, at least hundreds of elite level athletes and thousands of probably top tier athletes. And the businessman, the billionaire, usually gets their brain mapped, and you show them where there's problems, and they say, well, your test is wrong because my brain's perfect, right? Because it's usually more that ego side. And what I always tell them is, well, remember what we're looking at, that activity that's staying up, we're looking at that at a resting state. That would be like a marathon runner saying, well, my heart rate should always be at 140 because it gets up to 140 when I run. So isn't that what makes me a great athlete? No, you want it. We're not lowering your cognitive ability. We're just allowing your brain to come down to a resting state and then go way up when you need it. And those businessmen might need acute anxiety, a lot of it throughout the day, but then they need to come back down and get recovery, get good sleep, you know, for relationships and things. Where the athletes, what I always love about working with athletes is, you know, and I did a lot of work with Red Bull and with Andy Walsh and stuff too. And, you know, and they always are like, please show me an area where I can unlock more potential. I'm already doing good, but show me an area. They get ticked off if you say their brain's perfect. They're like, no, I want more potential, right?
Can you give an example of someone, you know, perhaps in this Monarch community, because that's some people in our West Hollywood community initially turned us on to you and your work. So do you have any specific example of someone who's done exceptionally well with your program and what you know, saw big picture from where they started to where they resulted?
Yeah. So, you know, one of the people that, you know, we mutually train and kind of brought us into this a little bit too, or at least introduced us, you know, as a DJ. So he is up late at night, one of the biggest, you know, guys traveling all over the world, different time zones, up till 2, 3, 4 in the morning a lot, you know, and obviously that throws off your sleep completely. And that's his job. You can't change that, right? You can't tell him to go to bed at 9 o'clock and sleep till 7, you know? And so, you know, with him, when we train the electrical activity of his brain so that his circadian rhythms don't keep getting thrown off, to keep it within, we can optimize sleep cycles to where even with 5-6 hours of sleep, you can get maximum optimization of your sleep cycles and get the recovery that you need. We did a lot of that for the Special Forces, where the Department of Defense hired us to try and optimize their sleep cycles, because if they're sending in a team of 10 people, they want to have them awake and optimal, cognitively at their optimal state the whole time without having 8 to 10 hours of sleep, right? So I think, the DJ is probably one of the biggest. Some of the other ones, I think it's also a lot of what we did is took their brain and optimized it, but also took a lot of the prevention, or took a look at a lot of the prevention stuff. One guy that I think we both have in common too is very big into longevity. And I love, what he says, and what some of the other guys in his group always talk about is, this guy's a very successful businessman, but what has gotten him to this point will also kill him early, right? The stress levels, the sleepless nights, the constant going, no turning it off. That's what's got him to a successful state today. But you just took 20, 30 years off your life. And so, kind of undoing some of the damage that he's done to his brain. And when I say damage, really, it's the dysregulation from staying in that stress state constantly, low sleep patterns, and now being able to allow him to get the recovery to enjoy the rest of his life to 100 plus, based on, what he's created already.
I'm almost finished with Steve Jobs, Walter Isaacson's biography of Steve Jobs. And towards the end, Steve is convinced the reason he got pancreatic cancer and his life was curtailed is because he just way too much stress.
Absolutely.
And his body just became dysregulated. And the mechanisms that allow us to live a long and healthy life, things that Blue Zones practice regularly, like we can easily disrupt those, and we are very good at it.
Absolutely.
Final thought, just because a lot is transpiring in our world with regards to intelligence and AI and, how we are we're moving into the age of people who ask better questions and have a sharper intellect, will be able to use these new tools and technologies to separate themselves from others. In the world of cognitive performance, brain health, like where do you see the next 5, 10, 15 years in terms of like what will we do with your world to help the rest of the world? Like where do you think it goes?
Well, I think that there's a big push into, preventing dementia, right? I always say that dementia, according to a lot of the studies that are out there, and again, I can't say this is fact quite yet, but everything's leaning towards this. So dementia is one of the most preventable diseases there is. However, you can't reverse it once you get it. And again, just like if you've never heard of a dentist and your teeth all fall out, the prevention side is important on that. So I see a place where longevity, we're living to, 100, 110, 115, maybe even longer, definitely, because, the stress that we put ourselves through in our society is no different than if you tried to keep your arm just flexed constantly and never let it down. Your arm will break down. Your muscle will break down. Your arm builds during the recovery phase, right? And same thing with our brains. They actually regenerate. The calcium ion channels regenerate when we're asleep, when we're relaxed, when our stress comes down. There's a lot of processes that help in our immune system, our hormonal regulation, our metabolism, all that happens during those deep sleep cycles. And once we start focusing on that, again, that doesn't mean sleeping 10 hours. That means optimizing the time you do sleep. And once we have that, I think longevity is going to be completely different. But I also think we're going to be able to perform at the highest levels without the sacrifice of fun, community. A lot of the Blue Zones, it's because of the community. It's because of the long meals and socialization. And the problem is that our society is so focused on, really achieving, and that achieving takes so much stress to achieve, where I think we're going to be able to achieve the same levels without near the stress.
When you were talking about that, and this kind of be like my final thought and the question that I would pose to the people listening and hopefully are motivated and inspired, is like, we see athletes today who at the age of 40, like I remember seeing John Elway. John, if you're listening, I apologize. Like 45 years old playing in a pro-am,
right?
The guy could barely walk. Like it looked painful, but that was the cost to get him to where he was. Exactly. And I think in the world of physical movement, we are better understanding recovery, rehab, how much, like LeBron James plays 20 plus years at a super high level, like probably didn't happen in the 80s or 90s. But what if there was a world where we had a Michael Jordan or LeBron James where you could do that till you're 50, 60, 70, and you maintained the intellect of an Einstein for 120 years? Like if we had those people, like think about how much good could be done because we've extended the cognitive span, the physical span, and it's just like you get people that are like, we want to continue to create and do incredible things for decades versus like what you said, stress, lack of sleep, alcohol, poor diet, and you get this brief moment of brilliance, could be 10 years, 20 years, 30 years, but then it all comes crashing down. And then they're like a sad shell of what they used to be. What if it didn't have to be like that? I think that, at least from my standpoint and your standpoint, seems like a mutually agreeable goal that like we're all moving in that direction. We need you, we need us, just like the body and everything needs to be together.
I couldn't say it better.
Beautiful. Well, thank you for coming in.
Perfect.
Grateful to have you as part of the ecosystem. And everyone listening, stay tuned because we're going to continue to evolve and hopefully build on this Monarch mind